right, so we're going to transition over and we're going to talk a little bit about simulation. How many of you guys actually handle a simulation within your shops? Okay, a couple, not everyone. So we'll make this fairly brief. So for one, I mean, simulation has become pretty standard. Most med schools do it, almost all residencies do it. But why do we do simulation? So we do it because it's a safe place. It's a place where residents and students and other learners can practice something that maybe doesn't happen very often or that's really high risk in a safe place where they can't actually harm a patient. They can also practice different skills, communication, and medical knowledge. They can do this in a more realistic environment, and they can do it at their own pace. They can do it over and over again if you have the time and resources. If they kill the patient, they can try again. ACLS, you can do the mega code again if you fail the first time. And you can practice a lot of different things this way. You can do actual clinical skills. You can do medical knowledge. You can do communication skills. There's a lot of different things that you can learn with this. So here's the objectives we're going to cover today. So first, we're going to talk about classifying the 5 different types of simulators. So first is task trainers. I love task trainers. This is one of the most obvious uses of simulation. So this is your procedural skills, your psychomotor skills, something that they have to practice with their hands. And so these are just some examples of some of the task trainers we've done at ours. A Crike model, a chest tube simulator, a peritonsillar abscess simulator, and a C-section simulator, emergency C-section perimortem that we've done. You can do low fidelity. Believe it or not, because of the way sim works, doesn't matter. It could be a piece of cardboard that's shaped like a person that they're practicing over, as long as there's some other components that we're going to talk about in a minute. But this can be anything from your CPR Annie to a blow-up doll that you want to have them work on. High fidelity is what most people think of simulation. This is your sim man. You're really fancy. It's got pulses. It breathes. It blinks. Things like that. And it's great, but it's not what makes simulation. You could do bad simulation on a very fancy $1 million sim man. People overlook this, but all of the standardized patients, if you're doing an outdoor wilderness thing and you have standardized patients, these work really well for simulation. Augmented virtual reality is becoming more common. There's a lot of different simulators out there that use your actual environment so you don't get dizzy, but put a patient that is a virtual patient that can seize or have chest pain or talk to you, things like that. So let's talk about what is required for simulation. As we just talked about, there's 5 different types. It doesn't matter what you're doing, but what you really need is you need deliberate practice. The residents have to be deliberately trying to do whatever you want them to do. There has to be reflection. They need to think about how they did and what went well and what didn't go well, and there needs to be feedback. If you have all those things, you are doing sim well. If you are missing a piece of those, you are probably not doing sim well. Let's talk about the need to suspend disbelief. So there's something called a fiction contract, which is basically my residents come into simulation and they agree to try to suspend disbelief and believe that pigs fly and that this is a real patient. And my agreement is I will teach them something if they will do that. And there's ways you can do this better. High fidelity simulators obviously help. But being very serious about it also helps. The Confederates and the instructor need to take it seriously. If you're cracking up the whole time, they're not going to take it seriously. It's not going to do suspension of disbelief. And I've watched sims go that way. And I know sometimes it's funny, but you just have to take it very seriously. Your Confederate needs to take it seriously. Funny voices don't really help. You can do Imagineering. Think Disneyland. You can have sound effects in the background. You could have a preemptive video. We did an airplane simulation where they were stuck between 2 rows of seats. They could only walk down the aisle, and there was airplane noises in the background. And it worked really well. And it was just an emergency on plane simulation that they ran through. So there's a lot of different techniques you can have to focus them, but really as long as you're taking it seriously and you ask them to take it seriously, you can get a long way just with that. How do you pick your objectives? We just talked pretty extensively about objectives, but so for simulation, the biggest thing is decide what you want to focus on and stick with it. Are you focusing on communication skills? Great. Then pick a fairly straightforward case and have them run through that and work on the communication with interdisciplinary people. If you want them to learn a medical thing, thyroid storm, something they don't see often, then make the case the focus and make everything else simple. Again, I've watched some simulations where the Confederate just decides to start being a ridiculously pain-in-the-butt nurse in the middle for no apparent reason, even though it's already a difficult case. That does not help. That just pisses your learners off, ruins the suspension of disbelief, especially if the nurse takes it too far, and it's not helping your simulation at all. So decide what your objectives are in advance and make sure your Confederate's aware, hey, you're being straightforward, you're helping, you're being a normal nurse. The focus is this, okay? And make sure everyone's on board about what your objectives are. This is key. So the 9 steps in creating a simulation. So first, you need to think about who. Is this med students? Is this residents? Are you doing faculty? Is there someone else you're trying to focus on? Are you doing interdisciplinary? Are you actually going to have a nurse, a tech, and a couple residents there? Those are awesome because everyone gets something. When you do that, it's a little trickier because you need to make sure everyone has their own objective in the simulation, so everyone's getting something out of it. But they're great because you don't need confederates, and it's much more realistic. Helps with the suspension of disbelief. For objectives and goals, again, if you've got more than one group doing it, you need to focus objectives for each individual group. Otherwise, I'm focusing on teamwork. I'm focusing on communication skills. I'm focusing on this medical knowledge concept. Pick your objectives and goals and run with it. What kind of type simulator do I have? Do I have a high fidelity simulator? Is that what I want to use? Is this a procedure where a task trainer is much more appropriate? Pick what you want. Is it a simulation that requires a procedure? And I want them to do that in the middle. Make sure you have all of the equipment that you need. Then you're going to write a general case overview. This kind of patient, here's what I generally want to happen. After that, you're going to make your decision points and your cues. If this, then this. If they don't do this, patient decompensates. If they don't do this, patient needs to be intubated. If they do this, this happens. And this is where it gets a little tricky because you need to make sure that, again, anyone could run this. Anyone could look at your simulation and know exactly what to do based on what your learners are doing. Then you're going to create debriefing questions, which we'll talk a little bit more about in a bit. We're going to pilot it, we're going to implement it, and I'm really big on sharing it. We are all working very hard. Like Dr. King said, you really wanted to make sure that you are distributing the stuff, getting it out there, getting credit for your work. So let's talk about effective debriefing techniques. This is what I think most people struggle with the most. You want to make it a discussion. In my opinion, there should never be a PowerPoint involved in simulation debriefing. Just doesn't belong there. It's not a lecture. I'm not going to tell you about thyroid storm. We're going to talk about what went well, what you think went well, and I'm going to give you some feedback. That's what's going on. Again, reflection, feedback. Those are the key components of, along with the deliberate practice of simulation. So I always just start it. How'd that go? Can you give me a summary? And if no one talks, hey, can you give me a summary of the case? What happened? What'd you guys do? Okay, how do you think this part went? What do you think you did well in this case? What would you do differently in the future? This is not, once you get used to making the questions and what kind of questions you want to ask your learners, it's not hard to do a debrief. It's not a lot of preparation for you. You just need to get them to talk. So ask them very specific. If they won't talk generally, our residents have gotten very used to this. So they'll have a whole discussion after like two questions on me, and I'm like, great, this is awesome. And they do a really good job on reflecting on their own behavior. But if it's not working, give them a very specific point in the case. At this point, how do you think that went, and what would you do differently next time? And have them all discuss it. And once they get used to this, they get really good at it. And then you obviously want to go back to giving them that direct feedback. I think you're right. I think this went really well. I think here, there was no closed loop communication. You need to work on that next time. And the last thing is some good resources for you guys. There's a lot of places. MAEd portal obviously has a lot of simulations. Anything, if you just look on Google Scholar, there's a lot of like random little places that you can find simulations. And then GenerationÄ has some simulations up there. So, and if you guys have them, again, share them. There's other places you can put them. Get them out there. We don't need to all reinvent the wheel. There's some amazing cases out there. So, any questions on simulation? I know a bit of a whirlwind tour, but everyone can write simulation cases. It's very, very straightforward and easy to do if that's in your realm.